I'm Dr. Shakuntala Bharvani, age 75 plus.
And I'm Mahendra Shah, 84 years old.
Our last video on burns proved extremely popular, and we were inundated with questions and details. Some of the more important questions were: what is the first step, the first aid that should be taken in case of a burns incident? And the next important question was, are there similar treatments for all kinds of burns? For example, if there is a fire at home during a festival when diyas are kept alight and candles are kept alight, or when there is a cylinder burst and there is a terrible accident, or if there is some electric short circuit, and then of course, as always happens, some accidental use of acid or chemicals which also burn the skin. The answers to these will be given to you by my co-panelist, Mr. Mahendra Shah.
Thank you, Shakuntala. I want all of us to understand that the protocol of first aid, regardless of the cause of the burn, is the same. So we have to know the golden rule, and the golden rule is that we cannot lose even a fraction of a second if we don't want the skin to be further damaged. So don't wait even for making a call to doctor. Mm-hmm. The very first thing is to cool the wound by pouring water on it.
Yes.
And keep pouring this water till such time the patient feels that the burn sensations have stopped. Mm-hmm. In other words, it may even take you much longer, sometimes going up to 1 hour. Does not matter, it is preferred.
Yes.
And I must caution you, don't use hot water, don't use very cold water.
Room temperature.
And don't try any experiment with greases and butter, and all that will ruin your skin. Mm-hmm. This is the only gold standard, and stick to it.
Yeah.
Now, having done that, all I would say is remove the excess jewelry and clothing if they are on the parts of bodies which are not burnt. Mm-hmm. But in case they are stuck with the burnt area, then please don't disturb them.
Don't pull them out.
Yeah. And having done this, now gently apply soframycin cream. Mm-hmm. And after the soframycin cream is applied, you gently have a cling film around the scar.
Yeah, cling film, Mahendra, I'm glad you brought up that point, because cling film does not stick to the skin.
That's right.
And it can be taken off very quickly without any trauma. And most important, it prevents infection.
That's a wonderful point you make. And then there is a question of other secondary actions. Mm-hmm. First and foremost, give them a painkiller, a dolo.
Yes.
And continue to hydrate them.
Yes.
Just give them sips of water all the time. Mm-hmm. And then make sure that some warm clothing is put up on the rest of the body. Mm-hmm. Because if you are cooling this area for a long time, then it is possible to an old person, it could result in a body temperature drop at a very severe level.
Yes.
So do that, and if possible, raise the body parts which have got scarred, so that the swelling will be contained.
Yes. Yeah, those are good points. And of course, if the scars are deep and the burn wound is large, hospitalization is important, and so are doctors. And if there is dizziness or breathlessness, these are symptoms which should be attended to immediately, especially if the patient has a history of other diseases.
Yes. So any comorbidities, then let hospital and doctors take care of that.
Yes.
And of course, electrical and chemical wounds, regardless of how they appear superfluous, you must refer them to the hospital.
Lastly, we must remember that treatment begins at home and continues at home. If you have understood and liked this video, do write to us. We would love to hear from you. We have helplines. Mahendra will give you a helpline, and other lines will be put up on our YouTube.
Okay. The emergency helpline is 2779-3333, and care of Dr. Sunil Keswani, one of the foremost skin specialists, is 98200-31881.
Thank you for listening, and please write to us.
Thank you.